Getting ready to get started. Just hang tight. Hey guys, glad to join in. I'm excited to team up with Microbalance again today, talk about some homeopathy. We're going to give it just a moment to get going. You guys, this is such a great topic, especially with the different things going on in our world, the healthcare. People are taking back their own power and their own advocacy in healthcare. So talking about homeopathy is a great way to empower people. So I'm so excited to get started on that tonight. We'll give it just a little bit longer as people trickle in. Good to see everybody joining in. Glad to have you guys listening live. So as I said, tonight we're going to talk about homeopathy in your health, a short and simple guide to homeopathy for healing. I'm Dr. Martin Hart. I'm teaming up with Microbalance tonight to bring you this live video so we can answer some questions and get you guys some great education going. It's really important for me to tell you at the outset that this is for educational purposes only. It is not a medical treatment or diagnosis. So it's just educational for you guys, okay? All right, we're going to start jumping in talking about homeopathy. First of all, what is homeopathy? Well, it started by Samuel Hahnemann, a medical doctor. Okay, what he found way back when, hundreds of years ago, was that he was dissatisfied with the medical treatments available at his time. They were making people sicker, they were difficult, and so the medical treatments were difficult to administer, they were difficult to tolerate, and so he wanted to try something different, and so he figured out homeopathy. Okay, so homeo means same, and then pathy means like a way of treatment or a technique or a way of dealing with pathologies. Okay, so homeopathy is using the same chemicals to deal with an issue that created the issue. So what we do in homeopathy is you sit down and you do a very good interview, a very good exam. And so thank you so much, guys. I really appreciate your kudos out there. And so we do a really in-depth exam. We want to get to know everything about you, your background, right? Where did you come from? What sort of childhood did you have? What childhood illnesses did you have? What illnesses did your family have? What's your personality like? We want to know about your constitution. What are your tendencies? What's your temperament? And then we also want to know what are your symptoms you're dealing with now. And when we have that whole picture, then we can find the best remedy for you that fits your illnesses. Because like cures like. That's the fierce principle of homeopathy. Like cures like. So if you're dealing with inflammation, right? Lots of pain, inflammation, itching. You're dealing with maybe some rashes, maybe some rashes that weep, okay? And you tend to see a break out in those. Well, we might give you roost tox as a homeopathic remedy. And so that is a dilution. What does that mean? It means you take roost tox, which comes from poison ivy, which causes red, weepy, painful rashes that are inflamed, right? So we use that roost tox and we dilute it until there's no roost tox left. But what's left is the energy of that molecule, okay? And that's like information for the body. So you give the body the information about those exact same issues you're having, and then it knows how to deal with them, and then the body can be promoted. It can be basically triggered into clearing that and healing that pathway, right? So that's like cures like. And so what's happening there is the body's given information of how to deal with the issue it has, so you can trigger your body's own healing mechanism. That's the first principle of homeopathy. Okay, and we have Samuel Hahnemann to think about that, someone who saw a problem in his own time and said, how do we deal with this? And so he started to figure that out. And number two, the second principle is the minimal effective dose, right? We don't want to give any more or any less than you need. We want to take you right up to the maximum benefit, nothing more, nothing less. And so homeopathy does that partially by finding the right potency. So what does potency mean? That means how far do we dilute something? Right? So you can take it all the way until what they call Avogadro's number, where there's no actual substance left, like there's no poison ivy toxin left in there, but the energy of it's left. And you can actually prove that via nuclear magnetic resonance imaging and spectrometry. We can see that whatever the base you're using, whether it's water or saline or glycerin or alcohol-based, right? It'll hold that different energy. It's different. So a homeopathic remedy made from alcohol is different than plain alcohol, and they can prove that via research, okay? And so we could say we could dilute that 30 times. We could dilute it 200 times. We can dilute it 1,000 times and everything in between. And each one has a different mechanism, okay? And so if you do a low potency, in homeopathy, we consider that a little less deep of an issue, and you're trying to stimulate something, okay? So if you want to stimulate, let's say, the body's ability to grow bone, right? You might give somebody homeopathic, which is called a sarcode. It's a body tissue. A sarcode is a body tissue of osteoblasts, which are the tissues and the cells that make bone. You might give them a low potency, like a 6C potency. It's been diluted 6 times, 6 to 100 times. And so at that point, that's a great dilution right there. But let's say you just want to balance something. Well, you might give somebody a 30C potency. So if somebody's very overstimulated, right, they're very wound up, maybe they've got loose stools, and they're agitated and anxious, you might give them coffea cruda, which is coffee beans. But you might dilute it 30 times, and that can help balance them out, balance out the body's pathways that deal with those same issues. Now, if you want to go even farther, maybe like 200C, you could deal with a long-term chronic problem that's been there a while, that's very deep-seated, and you're really trying to work with the body and harmonize the body at that very deep level. And so something like that, you might deal with something that's more of like a deeper tendency. Like you might deal with something like staphysagria, right? And that could deal with like shock or trauma that's very deep-rooted. And so you give somebody a 200C potency of that, they've dealt with that maybe like a childhood trauma. And so it works through that. And so that's the minimal effective dose. You want to find the exact dose that works for them at the right potency at the right time. Nothing more, nothing less. Okay? We don't want to overdo it. Like if you've ever been overtreated with a medicine and had too much of it, right? We don't want to do that, and we don't want to underdo it. We want to find that perfect dose. And then number 3 kind of goes along with what we've been saying already, but is individualized treatment. We want to figure out exactly what you need individually. So we don't just want to treat the symptoms, right? Homeopathy doesn't do that. But it also wants to look at your temperament, the whole picture of what you're dealing with. So it can specifically help you on that front. Now, there's been a lot of modern advancements in homeopathy where now we're figuring out traditional homeopaths used one remedy at a time and went with that. And what we're finding, because just like any science and art, it advances, okay? It finds new modern techniques. It looks at what worked, what didn't, and it advances, it evolves. And so homeopathy finds now we can combine things. We can combine more than one potency. So like, for instance, with Microbalance Health in CellTropin, which is a great one meant for like the brain and pituitary gland and neuroendocrine rebalancing after dealing with mold illness, it uses multiple potencies. We call that a chord, okay? So it uses multiple potencies of, like, let's say pituitary gland, which is a sarcode. It's a human gland to help to heal that. And so it can do that at different levels. It can help stimulate it. It uses a bigger potency to help the deep-rooted healing and health, and it uses a balancing potency. So it hits all those angles. And so we can, in modern advancements now, we do that. Now, a really cool modern advancement is research. And research in homeopathy, there's different ones. There's ones that do various clinical trials to see how does homeopathy compare with other treatments. It does very well. Okay, there's other trials that say, does homeopathy somebody might say, oh, you're diluting it till there's nothing left. It's just water. Well, now we know that's not true. We can do different magnetic resonance imaging on it. We can do spectrometry on it. We know it's different. We know it has a specific energy signature, a specific informational energy signature. Okay? So now you know some of the principles of homeopathy, right? Like cures like, minimal effective dose, very individualized treatment. And then we can go a little farther and we can say, what are some different types of homeopathy? Well, one type is using sarcodes. I've talked about it a little bit. That's using like different human tissues or glands or things like that to help mimic that. So that might be like if you got a thyroid issue, you might use a homeopathic of human thyroid glandular that's been diluted, right? Or just like in CellTropin, pituitary glandular that's been diluted to a great level there to help stimulate that. Those are sarcodes. And then there's also nosodes. Nosodes are dilutions of diseased tissue, okay? So that might be, for instance, like in Sinus Defense 2.0, which we're very excited about. It's the new Microbalance homeopathic product that's very, very good for the immune system, supporting the immune system. It has nosodes in it. So it might have nosodes of different bacteria, such as Borrelia burgdorferi, Lyme disease. It's got some different ones that cause strep or staph. So if you've dealt with mold illness, if you've dealt with chronic inflammatory response syndrome, you know about Marcons, which is a staph infection that grows in the sinuses. And so when you give the body a nosode copy, if you give that body a diluted copy of that bacteria, there's no bacteria left in there, right? It's homeopathic. It's diluted to where there's no bacteria left. But if you give the body that nosode of that, now the body has the information to know how to deal with it. Because if you're giving it to an amount that doesn't harm it, you're giving it to a way you're just giving it the information. And the body says, wow, thank you. Now I know what to do with this. I can start to handle it better. Okay? This is a similar idea of what they do with like allergy shots. They're giving you highly diluted, basically homeopathic dilutions to some degree, although they put a bunch of other junk in there that we don't like, but that basically stimulate the body's immune response. They teach it what to do, and that's what homeopathic nosodes can do. They help teach the body what to do. They support the body in dealing with these things. And so that's a really amazing types of sarcodes and nosodes types of homeopathy that we use every day here in the office for tons of different reasons. Especially I do them a lot with molds, some different types of bacteria. We use Sinus Defense 2.0 on that front to help the body retrain the body, help the body adapt to those issues. And so if you've dealt with homeopathy in that front, I've seen that work wonders with things like, now we're not treating it, we're supporting the body in dealing with it, like Lyme disease or the co-infections. Okay, I've seen it work wonders on that front to help the body learn to deal with it and process it much better. And so that's a biggie. How do we support the body on that front? Okay, we're doing good here, guys. Getting a lot of the good principles in, learning a lot about homeopathy, how it's a great way, a very safe, very gentle way to support the body in healing. Now, how does homeopathy work, right? I talked a little about it gives the body information. One way, when I was trained in biological medicine, that we learned about this, and this is what the Swiss biological medicines medical doctors talk about, is that homeopathy works on a couple different levels. It works partially on the body's structured water level. So around all the cells, there's that fourth phase of water, kind of like almost like a gelatinous or structured water. Okay, which helps information travel in the body. Homeopathy partially works on that level, and it works partially on the extracellular matrix and the cellular level to deliver some of these informations. Okay, so it's important to remember the way these things work in our body so we can understand it when we take it. What is it doing? Okay, and when you know what it's doing, you're giving it a little extra boost for that body's systems to function in that way. So we talked a little about sarcodes like CellTropin. And how do I use CellTropin and sarcodes? I use it a lot as like a cleanup procedure. When somebody's got mold illness, a lot of times their pituitary gland and their brain is affected, which affects their whole neuroendocrine system. What does all that jargon mean? It means stress. It means that you're peeing out all of your fluids because you can't retain fluids because your pituitary gland helps signal your kidneys to hold on to them. It means that stress response, sleep, energy, all those things are going to be affected, blood sugar. And so when we use something like CellTropin, it's giving messages to the pituitary gland of the brain. Here's the information you need to heal. Here's the information you need to repair yourself. Okay? And we'll talk about that more in some questions in a moment too. But that's a great way CellTropin works. Sarcodes. How do I use nosodes? Well, that would be something like Sinus Defense 2.0. So nosodes that are going to teach the body how you're dealing with those specific microbes. Okay, so maybe it might be like Borrelia that lowers the immune response and affects all sorts of different body tissues. Okay, your body needs to understand how to deal with that, especially because Borrelia is very unfamiliar for many people's immune systems. It could deal with the way they've dealt with strep, like chronic strep. If you dealt with chronic strep, sometimes your immune system just gets beat up and it's like, I don't know what to do. And so you need to give it a little more coaching. Well, that's what this does. Then on top of that, Sinus Defense 2.0 goes a little further and it adds in transfer factor, immune factors, which they support now. Not only are they nosodes, but they're kind of similar to sarcodes in that front, where they're also helping to stimulate the body's healing response, teach it how to understand and recognize mold, teach it how to understand and recognize fungal infections and these other microbes, right? It's not treating them, it's supporting the body in dealing with those in a very, very effective manner. I'm very excited about the new formula. We got it in. It's been testing fantastic. We actually just sold out of bottles today, so really excited about that on that front. Okay, guys, I think I'll give you a little primer here on how homeopathy works, right? So homeopathy, hundreds of years old, started by Samuel Hahnemann, who was a medical doctor who was fed up with the medical treatments at his time. Does that sound familiar, right? Aren't you guys fed up with the Western traditional medical system, unfortunately? And I hate to say that, but it's a reality, okay? He was too, hundreds of years ago, nothing new, okay? So he wanted something new, so he went and he dug in. And the crazy part is, when you look at what he did, he was doing early randomized controlled trials, right? Give people these substances, what happens? And that's what became the homeopathic materia medica. Wow, was he ahead of his time. And so he was categorizing and logging all of these things and having, as he's training other doctors, having them all log it, and so they could see what's the commonalities. If you look at a homeopathic materia medica, they've got all these indications for each remedy, but they've got their gold standards, right? This was proved across the board by everybody who studied it. So we know it's good for this, okay? And then et cetera, et cetera. So that's so cool that they did that and he started that tradition. Okay, so he's very much about what works, what doesn't work, sticking with it, and adapting as needed. We talked about some of the principles, like cures like, minimal effective dose. individualized treatment. A good homeopathic practitioner takes a very detailed history. Okay, we want to know everything we can about you because we want to treat the whole person. And then we talked about different types of homeopathy, sarcodes and nosodes, and how the new products from Microbalance Health and the old trusted ones like CellTropin, how they function, how they work in homeopathy. We talked about how homeopathy works as an informational energetic medicine to the body, as a coaching mechanism. We talked about structured water, and we talked about the extracellular matrix, how it affects those. And then we talked about research and how they're doing modern research on that. And so they're keeping us abreast on that and keeping us up with the times and modern scientific principles. Okay, so I hope that's a great primer for you guys on homeopathy. Let's answer a few questions. I had a few that were pre-submitted, and I want to make sure I cover those so I'm fair to everybody there. So let's start with here. I'm going to read this off. I have a question for the homeopathic webinar. Is it possible to regenerate glands or organs such as the pituitary that have been heavily damaged by mold? If so, how does a person go about that? And is there an average for how long that takes? I've looked into organ and gland sarcodes but have read conflicting information for potencies to use. Okay, number one, I have seen the body do amazing things with regeneration post-mold exposure with a good detox and health and repair protocol. So if you guys have followed along with Microbalance Health in general, you know that they've got a whole spectrum they work with at our clinic. We have a whole spectrum we worked with for dealing with molds and recovery protocol. Part of that is how do we recover and repair the damage that was done, especially that pituitary gland, right? One of the biggies that happens to that, there's a bunch of hormones that are affected. One of the biggies is ADH. That's why moldies were peeing all the time, right? Can't seem to stay hydrated. Oh my gosh, right? If you dealt with that, you know exactly what I'm talking about. It's because your ADH, your antidiuretic hormone from your pituitary, it's really reduced due to mold, and so your kidneys aren't holding on to the water for you. So drinking plenty of salt water, that's helpful, but we got to repair the pituitary. So using something like CellTropin, which uses a pituitary sarcode at multiple potencies, okay? And when I'm dealing with something like repair and regeneration of an organ, trying to get the body to kick in that mechanism, I find that a cord, which is what CellTropin is, multiple potencies, works very well, okay? So I've seen this work really well. Time frame is all different, but typically I see people having results within a few weeks. They're seeing improvements. Their hydration is better. Their energy is better. Mental clarity is better on that front, right? Not because we're treating those symptoms, but because we're treating the underlying issues and supporting the body's healing and repair mechanism, okay? So that's that on that front. Next question that was submitted. My question for Dr. Hart is, how do you treat long COVID when you have sears? Is IV therapy the best treatment? So sears, from a moldy perspective, is chronic inflammatory response syndrome. Okay, when you're exposed to mold over and over and you have biotoxin illness, sears is CIRS. Okay, guys, CIRS, chronic inflammatory response syndrome. So then what happens is any next mold exposure, or even sometimes other chemicals like VOCs and etc., you have a major inflammatory response. The body's like, whoa, and it goes into major like five alarm alerts, right, for that. And so, you know, everything you think of with inflammation and all your symptom flares at that point. So how do you deal with long COVID when you have sears? I find it works back and forth. I find long COVID can make people more intolerant to sears, more intolerant to mold, and the mold sets your immune system up to have long COVID, okay? So number one, are you dealing with the mold? Are you dealing with the root issues? Are you on a good mold healing recovery protocol? You got to be on a good mold healing recovery protocol, okay? Get detoxifying, binding up the mold, dealing with the junk in the sinuses, getting out of the environment, test your environment, use the mold plates from EC3, test your environment, and either get out or clean it, okay? And you can on that front. So we keep it clean. We keep the clinic here clean, air purifiers, and we fog and mist with the EC3 solution at least once a month just to make sure we keep everything nice and clean on that front. And so then you can do different factors on that. You can do something like Sinus Defense 2.0 to support the immune system, support transfer factors to help your body dealing with that immune system that's been beaten up. Okay, IV therapy, sometimes I recommend for patients, but more so if they're malnourished, okay, if they've got a deep malnourishment on that front, or if they've got long-term issues. So yeah, we use it, and I'll refer out for that sometimes. And I work with a lot of great integrative practitioners who use it and have great results. You have to do it, not necessarily, but is it useful? Sure. But I would say you want to support your immune system and the effects of it, and that's where homeopathy can really come into play there as well. If I don't have any of the pathogens Sinus Defense 2.0 like Borrelia, can I still use it? For sure. Yep, you can. I find if I do a lot of stool samples on my patients, almost all of them have pathogenic levels of strep. Not all of them, but a lot of them. And strep nosodes are in Sinus Defense 2.0. Okay, and so that's key. A lot of people don't really know what infections they have unless they test. Test, don't guess. And so Sinus Defense covers a lot of those biggies, but it's got more than just the nosodes. Okay, it's covering the transfer factors. It's covering the immune factors to support that pathway. And now, not to mention, this goes really deep into homeopathy. You don't have to have those symptoms to use those homeopathic nosodes, right? Like cures like. So like Borrelia, for instance, okay? What does Borrelia cause? Joint pain, muscle aches and pains, fatigue, brain fog, sometimes gut symptoms, okay? It can factor all into those. So if you're dealing with other issues, do you have those issues? If you do, then a Borrelia nosode might be very helpful for you based on the principles of homeopathy. Okay, I've seen that work wonders in people. Okay, there's a few other questions that were submitted, and I'll go through some of the ones in the chat box. Carrie says, would sinus defense be good for kids with immune system struggles due to mold exposure? It's not specifically if you have a cold or sinus issue, is that correct? Yes, you don't just have to have a current cold or sinus issues. If your immune system is weak, a homeopathic product like Sinus Defense 2.0 can do a really great job of helping your immune system rebuild itself, helping it to get back on its feet, okay? Those transfer factors are good, some of the other homeopathic molecules that are in it, remedies that are in it. And so that's a biggie. And then the nosodes can help retrain the body on that front. Like I said, homeopathically, it'll use that like cures like principle to stimulate those other processes. So a lot of those processes in there, like let's say, for instance, strep. Strep can cause anxiety, obsessive compulsive tendencies, rage, irritability. Okay, if you have those, then a strep nosode can help. It can also lower the immune system over long term. So on that front then, using something like strep and Borrelia as a nosode can help rebuild the immune system because it's going to stimulate those factors. I want to make sure that we understand that too, because sometimes we're so ingrained in Western medicine that it's one treatment for one symptom, right? Boom, boom. A pill for every ill. Okay? We get used to that. What do I take for this? What do I take for this? But when we're doing a natural treatment with something like homeopathy, you have to understand the mechanisms it's kicking into place. It's using this beautiful body with all of this intelligence and wisdom in it, and it's stimulating that factor, and it's coaching that body's immune system to do those things. Our immune system is way more powerful than any antibiotic ever could, way more powerful than every treatment ever could be, okay? And so if we can use that body's immune system and coach it and tailor it in the right way and stimulate its own processes, endless, okay? Endless possibilities of what can happen, what can be repaired, what can be healed, okay, on that front. So we want to make sure we're remembering that factor. Okay, let me scroll up here. Love the EC3 mold test plates. Oh, for sure. Those are, I get patients who use those all the time. Sometimes we do other mold testing if we need to do some other things, but like just on a day-to-day, week-to-week basis, oh yeah, so good. Okay, scrolling down to look at notes, see your questions. Looking forward to hear share about this topic. Thank you. I love talking about it. I treated with you. You're the very best. Thanks, Dr. Hart from Chicago. Hey, good to see you, Kelly. Really appreciate that. I always do my best to help all my patients, so I really thank you. That means a lot to me. Good to see everybody out there. What about post-COVID fatigue? Okay, this doesn't necessarily get into mold or anything like that front, so I'll stick it kind of on what we're talking about a little bit with homeopathy. You want to find a full picture of what you're dealing with, okay? So if you've got fatigue, what else do you have? You have brain fog, joint aches and pains. Are you still congested? We want to find things that deal with that. So I find fatigue, a biggie, is going to be that HPA axis, right? Hypothalamus, pituitary, adrenal, because that's what helps us get our energy. Every time we stand up, that HPA axis has to respond so we don't just fall over from blood flow, lack of blood flow to the brain. It also has to energize us, right? Those adrenals kick in and give us energy, wake us up in the morning. So something like CellTropin, that's going to work on the pituitary system, it's going to work on the neuroendocrine system, it's going to work on the energy pathways and brain, can be very helpful. But you want to find a remedy that deals with the whole spectrum, okay? I know somebody asked on a Facebook comment, I've got, how do I learn more about homeopathy? How do I learn more about, helping my family with this? I am really big on patients empowering themselves, okay? I know I've got somebody listening in who's learned a lot about her herbalism and homeopathy and it's kind of become her neighborhood medicine woman. I love that, okay? I want you guys to empower yourselves. And so listening to things like this helps, like so you can understand what the process really is with something like homeopathy. You can get Samuel Hahnemann's Organon, okay? That is his book he wrote with a lot of commentary, so you can start to understand what was he doing and how is he treating people. and then you can get a materia medica. Okay, and then I would like you to, like, learning some muscle testing can be really helpful. And so as we keep in with that with the fatigue, you want to learn in what's the whole symptoms you're dealing with, and then find the remedy that hits that big package. Okay, scrolling down. How long does it take for homeopathy to work? I've seen it work instantly sometimes. Okay, when the body gets that information, it can change what it's doing. It's going to use different brain circuits. It's going to use different energy circuits in the body, different organ circuits, and it can make an instant change. Okay, now sometimes it depends on what we're dealing with. Are we dealing with a long-seated issue and I'm having to use a really high potency? I might expect it to take a few weeks, okay, up to maybe even a little longer. But, you know, it can work for anywhere from, I would say, here's what I usually tell patients. Give me anywhere from instant to 90 days to monitor the effects, just because of the way the body systems change over. So, for instance, if we're wanting to regenerate an organ tissue, well, how long does it take for that organ to regenerate? The gut lining is very quick. So we'd expect that the new cells to be healing very quickly. Bones take a little longer, right? How long does a fracture take to heal? Well, minimally 6 weeks, but then totally heal, you know, up to 6 months to 2 years. Okay, so how long does it take a blister to heal? So, you know, kind of give yourself that time frame. And so as we're regenerating new cells that are healthier due to the new information we've given them, and we've given the body new pathways, we got to get it time to get used to it. But reality is, it can work instant. Not always, but it can. I fully healed from Lyme, POTS, and mold. Great job. I'm glad to hear that. But then I got COVID and have post-COVID fatigue. Oh my gosh, you guys, we are seeing so much long haulers post-COVID, immune system dysfunction. It's a big deal. Don't underplay it, okay? If you're out there and you had COVID and you haven't been the same since, don't underplay it. What is a homeopathic worth trying? Well, for sure, I would try 2, okay? Partially because I know they test well. Not just because I'm here with Microbalance. I'm here with Microbalance because I use them and they test well. Okay, so to rebuild the immune system, Sinus Defense 2.0, to rebuild and repair and support the neuroendocrine system, the HPA axis, CellTropin, those are great remedies there. You could also look at a low potency coffee cruda, okay, coffee cruda. So that's a good one to get some of the energy back. I've seen that really work wonders on that front. Let's see, belladonna is a good one too. Okay, I would probably do a medium potency 30C on that front. There's a couple ideas there. Yeah, we saw that. Love using EC3 plates. Great, love that. Do you recommend everyone test their home for mold? Yes. With no visible mold, without a doubt. If it's visible, oh my gosh, you got a big problem. Most of the time, people can't see it. Okay, I have so many people. Actually, I had a patient in today, and she said they just went on vacation like 6 months ago, big mold exposure, and they said there's no way this place is moldy. It was built 6 months ago. Okay, it was moldy. They ran the plate tests. Mold, 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 mold. It was terrible. She took a little setback. We had to work to repair it. So I don't care if there's mold or not. You can see, test. Test, don't guess. You want to know. You want to rule it out. I'm to the point now where if I even suspect it a little bit, I'm like, hey, we're going to ship you these mold plates. They're very affordable. You know, you can afford them. You know, it's very affordable on that front. Let's get you tested now so we know. For sure, test. Okay, post-COVID symptoms, fatigue, nothing else. So it would be the homeopathic, no other symptoms. I would start with CellTropin, repair the HPA axis, because we know that COVID gets some of those sinuses, and there's a very thin barrier right here. This is why it affected smell so bad. That barrier is very thin. So if you're smelling something, we know it's actually touching your brain. Isn't that crazy? If you smell it, it's touching your brain. And so that's pituitary, sits right up in there, right behind the sinuses, okay? So CellTropin's a goodie. Again, coffee cruda is going to be a great one for the fatigue. I find really well. You want to use a low potency on that front. And then maybe some sarcodes of adrenal, thyroid, pituitary on that front. Also, what are your thoughts on muscle testing actually combined with homeopathic treatments? I love it, okay? But you got to have a good muscle tester. And you want to make sure that you're starting with a good history, that you really understand the whole package, okay? You can muscle test blind, kind of what they say is like, does this test well for the body or not? That's an okay way to do it. But as somebody trained in homeopathy, I'm going to say, I want to know the whole picture, and I want to try to narrow things down first that say, okay, these 3 remedies would be good based on the clinical picture. What's the whole package of this patient? And then we can muscle test to see which one's the right one or which combination is the right one. If you're a good muscle tester, I think it's a great adjunctive way to test things out. Coffee cruda, belladonna, those are homeopathic remedies. So coffee cruda is basically coffee beans, but homeopathic remedies. So it's teaching your body how to use those same energy pathways that coffee stimulates. And then belladonna is one usually for inflammation and inflammation, the immune system, especially long-term infections and like autoimmune tendencies. Belladonna is a good one for that front. Can people do individual consults with you? You're the best. Thank you so much. Yeah, guys, you can check out Keystone Total Health. That's our Instagram, Keystone_Total_Health. For our Instagram handle, KeystoneTotalHealth.com. We do virtual and in-person consults. CellTropin, that is what I'm saying. Sorry if that wasn't clear, guys. CellTropin is a microbalance homeopathic product. We love it in the office. I use it all day long with clients and patients, especially on the recovery side of mold illness to repair the HPA axis. Is there something to help with sleep? There's if you pull out the Materia Medica, it's a thick book for homeopathic remedies. The sleep category is pages and pages and pages. So you got to figure out, is it falling asleep? Is it staying asleep? Do you have nightmares? Do you dream? Do you not dream? Do you sweat in your sleep? What's going on? And so very basically, you could start off with very simply homeopathic coffee cruda in a high potency, okay? Because if you're overstimulated, then you use a high potency of coffee cruda, and it's going to help you calm down. It's going to help the body calm down, and so support the body in calming down. And so you could use something like that. You could use homeopathic valerian root in a low potency to stimulate that pathway, or even like a sarcode would be homeopathic melatonin. Okay, and so you would look at something like that. Those are all good options on that front. A lot of times for sleep too, I might use like homeopathic gold or homeopathic hypericum, which is St. John's wort, which helps the serotonin and melatonin pathways. Sleep. Thank you for all the boost there, you guys. Let's see. Coffee cruda, can people CellTropin? Sleep, we just talked about. Yeah, thank you guys. Are there quality brands of homeopathics and bad brands of homeopathics? I haven't ran into any bad brands, off the top of my head, but maybe because I just don't use them. And if something doesn't consistently test in the office, so we do biofeedback, muscle testing, frequency-based testing in the office. If it doesn't test on a regular basis, we get rid of it because it means there's probably not something good with it. I obviously find Microbalance's homeopathic products test really well. There's some other companies we use. You guys can reach out if you want. Can you put your business in the chat? Sure can, guys. Let's see that. There you go. Boom. Added that one in there. Okay. So, so we put that in the chat. You'll be able to see that later in the chat in there. And you guys are welcome to reach out and message it all on that front. All right, guys. I'll make sure I get this stuff pinned up. That I'll get the video. I'll have Microbalance put the video up again so you guys can watch it later. I'll take just a couple more last minute questions as we're getting going here. How long should I take one of these products like Sinus Defense or CellTropin? Is it okay for me to take them every day long term? So a single traditional only when you have symptoms, right? So what I typically do with these is I'll test it out, but on average, I'm going to say somewhere between 4 weeks and 12 weeks if I'm trying to really regenerate something, if I'm doing some deep tissue healing. Okay, so I might use CellTropin for more like 4 to 12 weeks. I might use Sinus Defense a little more on and off. So maybe for like 4 weeks on, take some time off. And typically I'm having people take 1 to 2 days off a week. Give the body a break. Give you a break, right? Taking a protocol can be daunting. Treating can be daunting. Take a Sabbath day. Take a rest day on that front. But you can use them long term. I would say just take 1 to 2 days off a week. And usually somewhere between 4 and 12 weeks is pretty common. I have SIBO, so I'm not supposed to have alcohol. Can I still use the homeopathic remedies to have alcohol in them? Number one, I haven't seen that be a huge issue with SIBO, but my patients who do have issues, what you do is you make a cup of very hot water, almost like a cup of tea water, but no tea in it, like boil it, okay? Put your dosage in there. Let's say you've got 3 sprays of CellTropin. 3 sprays, you get it in there. Spray it in, okay? Put it in your thing. Let it sit and cool until it's room temperature. Then drink the water down. That helps the alcohol evaporate out. Kind of like when you bake rum cookies or whatever, the alcohol bakes out. Same idea. Okay, so I can't give you specifics on exactly how to treat based on the dosages because I can't give medical advice out directly. But what I would say is it's pretty common for people if they're going to use pellets to take 3 to 5 pellets at a time. Drops would be anywhere from 5 to 20 drops, etc. So you can always self-muscle test on that front. But you don't have to get super crazy when it's homeopathy. You want to get enough to get the potency in. And so usually if it's pellets, like five-ish pellets is pretty common. And then anywhere from 3 to 5 sprays at a time, 2 to 5 sprays at a time, and then maybe 5 to 20 drops, depending on what you're taking. Yeah, I agree. We're very powerful duo. I'm so glad that Microbalance lets me work with them. We love their products. They've been so good for us and our patients and clients. It's been game changers for us. All right, you guys. It's been great to see everyone. Great to have you guys in here. We kept this one a little shorter, so it's a little easier to digest. Hope you guys watch it later. Share it with anybody you find it's useful for. Again, remember that this is not medical advice. It's for informational, educational purposes only. Thank you, Microbalance. Thank you, everybody out there. Y'all take care.